Imagine this. You wake up one morning, look in the mirror, and realize you're dead. You smell rotting fish coming from your own body. You tell your family, "Take me to the morgue. I need to be with the dead bodies." Doctors tell you, "You're perfectly fine. You're alive." But you scream back, "No, I'm dead. My heart, my brain, everything has rotted away." This isn't a horror movie. This is a real medical condition that has affected 200 people worldwide. It's called Cotard's syndrome, or walking corpse syndrome. And today on Psyche Storm, I'm going to tell you the story of a woman who smelled her own decay. If you're fascinated by psychology, the dark mysteries of the mind, and the secrets hidden inside human consciousness, then subscribe to Psyche Storm and hit that bell icon. Because today's story isn't just shocking. It will force you to think about consciousness, existence, and self-awareness in ways you never have before. And at the end, I'm going to ask you a question that might make you uncomfortable. So stick around till the very end. Let's begin. December 2012, United States. A 53-year-old woman named as Maria, name changed for privacy. Her family called 911, but this wasn't a heart attack or an accident. Maria told her husband, "Don't take me to the hospital, take me to the morgue." Husband, shocked. "What are you talking about?" Maria, completely calm. "I'm dead. I need to be with the dead bodies." When the paramedics arrived, they checked her vitals. Heartbeat? Normal. Blood pressure? Stable. Pulse? Perfect. But Maria pointed to her chest and said, "This is all fake. My heart is stopped. My brain is rotted." Then she brought her hand to her nose and said, "Can't you smell it? I smell like rotten fish. I'm decaying." The doctors admitted her to a psychiatric ward. The diagnosis? Cotard's syndrome. And this wasn't just Maria's story. In Italy, a 43-year-old woman experienced the same thing. She told her family, "I have no brain. I have no nerves. I have no chest. I'm just skin and bones." When her husband offered her food, she refused. Dead people don't eat. Her weight dropped to dangerously low levels. Doctors had to resort to tube feeding. Forcefully. Because in her mind, feeding me is torture. I'm already dead. For her, being alive was a curse. Now you're probably thinking, are these people insane? No, they're suffering from a neurological disorder. Their brains are literally malfunctioning. We're getting it. And it's so rare that only 200 to 300 cases have been documented worldwide. What does that mean? If you met 1 million psychiatrists, maybe one of them has seen this case. Cotard's syndrome was first discovered in 14 and by a French neurologist named Dr. Jules Cotard. He encountered a patient named Mademoiselle X. and she claimed, "I have no brain, no nerves, no chest." Dr. Cotard called this le délire de négation, which means delusion of negation. Today we call it Cotard's syndrome, or walking corpse syndrome. What are the symptoms? Belief that you are dead. Feeling like your body is rotting or decaying. Olfactory hallucinations. Smelling rotting fish, sulfur, gangrene. Believing your organs have shut down. Refusing to eat or drink because dead people don't need food. Fear of mirrors, because I look like a corpse. The most disturbing part? They believe they're immortal zombies. They think, I've died, but I'm not allowed to truly die. I'm trapped like this forever. This is existential horror. Now let me explain the science that's behind this. Cotard's syndrome affects the 3 specific areas of the brain. 1. Fusiform face area FFA. This is the part of your brain that recognizes faces. When you look in the mirror, this area activates and tells you, that's me. In Cotard's patients, this area is damaged. So when they look in the mirror, their brain says, yeah, that's not me. That's a corpse. 2. Temporoparietal junction, TPJ. This area controls body ownership. It decides, this hand is mine. This body is mine. When this is damaged, patients say, then this body isn't mine. It's a dead shell. 3. Limbic system, emotional response. Normally, when you see yourself, your brain creates an emotional connection. But in Cotard's, the limbic system disconnects. So patients see their reflection, but we don't feel nothing. Their brain concludes, even then, if I feel nothing, then I must be dead. But there's another twist. 89% of Cotard's patients had major depressive disorder first. 47% experienced psychotic episodes. So the formula looks like this. From severe depression, psychosis, plus brain damage, Cotard syndrome. It's the perfect storm of neurological and psychiatric disorders. And one of the creepiest symptoms, the rotting smell. 60% of patients smell rotting fish, sulfur, or gangrene kedwin coming from their own bodies, but in reality, then there's no smell. It's an olfactory hallucination. So rather than you won, what's happening? When the brain believes, I'm dead, it manipulates sensory perception. The brain's olfactory bulb and the smell center becomes overactive, and it artificially creates a smell that matches the belief. What does this mean? To them, that smell is 100% real. You can explain it all you want, but they won't believe you because their brain is neurologically programmed to believe they're decaying. Now the good news. Yes, it's treatable. But recovery is slow and difficult. Or treatment options. That's 1. Antidepressants and antipsychotics. They control depression and psychosis, but success rate is only 31% in PANT with medication alone. 2. Electroconvulsive therapy, ECT. The brain receives controlled electric shocks. This resets the brain's neural pathways. Success rate, 76%. The most effective treatment. 3. Combined therapy. ECT plus antidepressants plus antipsychotics. Success rate, 84%. Recovery time, 4 to 8 months. Maria, the woman I mentioned at the beginning, was treated with ET and medication. 6 months later, she recovered. Today, she's living a normal life, but she says, those 6 months, I genuinely believed I was dead. No one could convince me otherwise. It was the worst hell I've ever experienced. Cotard's syndrome reveals a terrifying truth. Your sense of self is just brain chemistry. Your consciousness. You're an identity. You're not in a sense of existence. Now, it's all just neurons and chemicals when at work. If one small part of your brain gets damaged, you can stop recognizing yourself, and you can believe that you're already dead. This isn't philosophy. This is my medical reality. And perhaps the most unsettling question is, if your brain decides you're dead, are you really alive? So that was the story of walking corpse syndrome. If you found this video thought-provoking, hit that like button. Subscribe to Psyche Storm, because I'll keep bringing you more dark psychological mysteries that he like this, and Kai would leave a comment telling me, if you woke up one day believing you were dead, how would you prove to yourself that you're alive? Think about it and remember, reality is just what your brain tells you we need it to know. Psyche Storm.